with a single payer, you eliminate all of the marketing, the administration, paperwork costs of an insurance system.
And lawsuits. Or at least you reduce them.
Well, you reduce the lawsuits because any malpractice lawsuit has two pieces to it. One is the actual malpractice, and the other is the pain and suffering that the person will have for the rest of their life. If we have single payer, it addresses that pain and suffering.
The politicians and the employers are stuck in a time warp. And by that I mean back in the 40s was the first time that employers got involved with providing health care.
Oh, really? That's where it dates back to.
The Henry Kaiser shipyards, and they were doing that to make the jobs more appealing and to get people to help in the war effort. And it's been stuck on the employers ever since. Now, the employers would be really straight and honest, and they have from time to time. They would love to get this responsibility off their necks. But as long as it's attached to them, it's very difficult for them to be able to provide health care benefits because they're going up and up, and it just won't go down, as Phil says. Automobile manufacturers are spending, what, $1,400 per vehicle to provide health care benefits.
Wow.
And you can imagine what that does to their competitive status in terms of the global economy.
Sure.
An additional piece of that, this was reported in the media just a few days ago. If we continue the status quo, employers in the United States will spend $7 to $9 billion more every year than their foreign competitors because of health care.
And I hope I'm not too grim here, but they also own the Congress, you know. I went to a meeting and they said, well, let's go talk to our representative in Congress. And I said, well, she's already been talked to. That's what the problem is. And she's taken $537,000 from the medical industry, and that's across the country. So they're not representing us anymore. We could save a huge amount of money by eliminating the insurance companies, as they did in Canada. Just eliminating and taking all that money, but nobody in Congress is allowed to say that. See, so they say, Obama, how will you save money? He's not allowed to say, well, we would like to eliminate the insurance. You can't say that, see?
Because Congress people are unwilling to go against those special interests. That's why we've gotten to this what I consider a nasty option of a public option. I mean, it's just incredible the amount of money that is spent in congressional elections, and these are the people that now need to be satisfied.
One of you pointed out why the current system is so costly and why it's so inefficient. A few years ago, I had a Canadian physician who came to the office and needed to have a little medical problem dealt with, and so it didn't take long, so we actually talked about the system more than his medical problem. And I asked him how it was and how it worked there. He said, well, I have one person in my office to help run it. And when the patients come in, they present their card. The card is run through a scanner. And I think now they have their medical history and a few other key things on it. Every 2 weeks, we send in a list of people that we've seen in their billings. And every 2 weeks later, then we get a check. And that's that part of the system in terms of how it works. Now, what we have in our office now is 70 different plans.
Wow.
Those subdivide into numerous arrangements with employers in the community, and we counted them up, and there are 334 different arrangements with employers.
Wow.
So when we see any single patient, I'm a consultant, so people have to get pre-authorization before they come. That's fine. But then when we see that patient, we counted the number of steps it took to process a single patient encounter or single visit. 11.
Really?
From the time it gets pre-authorized to the time it gets sent. And we hire a computerized billing service to deal with this because we would sooner not deal with it as much as we can get away with. And then finally, you know, months later, we will get a check in the mail from X, Y, or Z insurance company. So when we say we're wasting 25 to 30% of the healthcare dollar, that's why, because going through this very dysfunctional private insurance companies. Now, what they come up with after 10 months of wrangling in Washington, from what I can see, is they want to expand this dysfunction by having people forced to buy more of these types of plans. Or, if you don't buy them, you will pay a penalty. So we're taking a bad system and then forcing people to buy into this bad system. And there's no ceiling on the money that they can charge for the premiums. So if you think it's difficult now to pay for that, I can tell you that if it goes through the way that they have it now, the system is already imploding, but it'll totally dissolve within a few years. And of course, it doesn't even start till 2013 the way they're playing it. So to me, it's a no-brainer to continue such a system like that. And the financial world had a meltdown a year ago, and at least people who bought mortgages that they perhaps shouldn't have bought at least had a choice, even though I think they were misled. What we're facing now is we're presenting people with no choice. You either buy into this or you pay a penalty, and you're going to have to buy into this faulty product. Frankly, we still end up with a lot of paperwork because we have denials, we have pre-authorizations, we have people switching from one plan to another, usually involuntarily, and thousands of patients sometimes are shifted from one plan to another.
Well, how's that?
Well, when Pima County decided to go with different options for their health care plan, and they dropped one company and they went to another company, there were something like 15,000 people who had to change. You can imagine how efficient that is.
It happens regularly. And my major disappointment with Mr. Obama is that he isn't tougher about this. I mean, he won the election. He's got the majority. Why doesn't he simply say, I know what is going to work best here, and this is what I'm going to do? And that's my disappointment.
If they just, you go in there and you have a one-thing amendment to lower the age of Medicare to 50.
I'm for
the
that.
Blue Dogs, the Republicans could not vote against that because there's a huge number of people who are over 50 now have lost their jobs. They have nothing. They're desperate. And you put that bill on the floor, and you'll get every Blue Dog and probably almost all the Republicans. Nobody can vote against that.
Hava wrote this guest opinion, single-payer plan would fix the system. And this was written, you can see it on the screen, it was written in the Arizona Daily Star, July 26, 2009, on page A10.
The people that I see in the office, I can hardly count the days before they are able to get Medicare.
By the way, I want to throw out one other thing, too, before we run out of time. Immigrants who are undocumented, should we cover them?
Culturally, as a society, we absolutely should cover them.
Right on. I believe that, too.
But in my judgment, but if it's one of those things that, you know, the politics of it are incredible. But I think there's a way to do it. When you're talking, most of the undocumented people in this country are from Mexico. Mexico has a very straightforward healthcare delivery system. There's basically only 3 entities in Mexico that deliver healthcare. That's not the private insurance industry that's trying to get in there now. But historically, it's those 3. And there's nothing that would prevent us, our country, if we had a single payer system, think of Medicare, Medicare administration going to those 3 entities in Mexico and simply saying, let's cut a deal. When when people I'm responsible for are in Mexico, you take care of them and I pay you. When one of the people you're responsible for is in the United States, I'll take care of them and you pay me.
Sounds great.
You're not going to get the amount of money in going in both directions that it costs probably, but you get rid of the political problem that you have with dealing with them.
Or suppose we're in Canada, or suppose we're in Mexico, or suppose we're in Spain, or Italy, or Germany, or France, or Switzerland.
You know what happens.
What happens?
They take, if I'm there, they take care of me.
That's what I thought.
And I don't get a bill.
The additional thing that should be considered is that everybody has an individual responsibility to do the best they can in taking care of their own health. And much of that has to start very young.